Hey guys, Dr. Justin Marcagiani here. Welcome back to the podcast. I have Dr. Nick Hool on today's podcast. We're going to be talking about his Hoolest device as well as natural ways to get and activate your vagus nerve. We're going to be talking about performing enhancements. Dr. Nick is a biomedical engineer, and his passion for human performance and activating vagus nerve and recovery and performance is going to really permeate in today's podcast. So I'm really excited to have Dr. Nick on the podcast. Dr. Nick, how are we doing?
Cool. What's up, guys? I'm good. Thanks for having me on. Excited to
Awesome.
share some insights.
Very cool. So Dr. Nick has a device called the Hoolest. I have it here. He's gonna show me how to use it live here. Oh, you guys can see live here on today's podcast. It's a vagus. Well, I'm gonna let Dr. Nick tell you about the device, but it's gonna work on supporting the vagus nerve, and we're gonna be diving into human performance today. So, Dr. Nick, how did you get into this area of focus?
Yeah, so I grew up a competitive golfer.
Hmm.
When I was in high school, traveled the country playing golf tournaments all over the place, and I was definitely good enough to compete with anybody my age in the country. And like every kid, you grow up with dreams of wanting to play, on the PGA Tour, being a professional athlete. And so, up until I was 16, I was pretty good. And I won a few tournaments, and I just was having fun being a golfer. And then when I was 17, I don't know what happened. Suddenly I started getting these like anxiety episodes, just on the first tee, in the middle of the golf course, before bed, before, a tournament. I just can't sleep. And I'm like, where's this coming from? I've never experienced this before. Like, just these performance anxiety episodes. And for me, when I was out there on the golf course and this would happen, your traditional relaxation techniques like breathing, mindfulness, meditation, like that doesn't work when you're in the middle of the thing. If you're out and about, right? There's the environment you're in might be crazy. You may not have a quiet place to go sit, especially when it's like, I got to go now, like we're performing. And so my thought was, okay, these aren't working, but there's got to be a way to shut that fight or flight response off. Because if I can go from 0 to 100, in a few seconds, why can't I go from 100 to 0 in a few seconds? Like that's like something in my brain there's like a switch somewhere. That was my thought. And so that experience led me just to want to go study the brain and physically, like what's going on when I'm having a stress response and I go into that state. Ultimately for the purpose to see, like, can we turn that off in the same way it can flip on and you're just, freaking out, in a few seconds. Can we turn it off and you're chill in a few seconds so that you can focus and get back to doing what you need to be doing. So yeah, that's kind of the backstory of how I got into this.
Okay, so very cool. So obviously you have your Hoolest device. How did the evolution of that work? Like, did you start in your kind of days being a competitive golfer? Did you start with breathing techniques? Did you start with visualization, NLP? What techniques did you start with, and how did you make that evolution to a biomedical device, or however you want to call it, to
Yeah.
support that? How did that work?
Yeah. The first thing I started exploring when I was on my mission to figure out, performance anxiety, I actually went to a psychiatrist, and he introduced me to visualization. And visualization was definitely the most transforming technique that I ever practiced, but it wasn't the answer to the problem I had on the golf course where I would get these anxiety episodes. Visualization was really good just because it trains your brain to be comfortable in a high performance situation, because you're giving your brain reps basically by closing your eyes, visualizing yourself performing perfectly. Your brain doesn't know the difference between what it literally
Yes,
sees and what you imagine, right? So
correct.
that's the power of visualization. And I tell everybody, I'm like, you guys should be visualizing if you're a performer. Like, visualize every day. It's the best thing you can do.
100%.
Um, but one of the things that's interesting is, in order to get into a visualization state, you have to practice relaxation techniques first. If your body is not calm and relaxed, if your mind's racing, you're not going to visualize. It's just not going to happen.
Right.
So the beginning of every visualization session starts with some form of relaxation. For me, it was progressive muscle relaxation where you'd like flex your entire body for 20 seconds, and then
Yeah.
you let go, and then you would just focus on calming every muscle in your body. And it took about 20 minutes to accomplish. So the first 20 minutes of a session, I'm not even visualizing yet. I'm exerting a bunch of mental energy just trying to calm my body down. And that's the state of the art. Literally, my psychiatrist is like, just remember, if you're out on the golf course and you are freaking out, do progressive muscle relaxation. I'm like, what? Like, I can't do that when I'm out there. That's not going to like work. How do I do that? And there's some breathing techniques you can try. And, I learned a lot of those.
Is there
But
a good
again, for
technique?
me,
I
like,
mean, are you a fan of like the Wim Hof breathing, or what kind of breathing did you kind of do when you were trying to really get yourself into a peak performance state?
yeah, there's just to summarize, there's really two types of breathing that I think are effective for performance purposes. The first is coherent breathing, which
Hmm.
is, essentially 6 breaths per minute, where you're inhaling for about 5 seconds and you're exhaling for about 5 seconds. And you do that for 3 to 5 minutes, ideally right before you're about to do some performance. The reason that's good because it matches your breath rate to the natural fluctuation of your heart. So when your heart rate is going up, you want to time the inhale, and it causes a little bit of a slight increase in heart rate. And then when you exhale, it causes your heart rate to drop. And so you get these big swings in heart rate variability, which is really good for optimizing your nervous system for performance. You want a
That's what
big
the M
swing.
Wave device does, right? The M Wave does this.
I believe they do that. There's a few, biofeedback devices that monitor your heart rate,
Yeah,
and
it
they
shows your
tell you,
coherence, and then it kind of
yeah,
gives you the ability to like, all right, breathe in now, breathe out then. It kind of helps you sync it up.
yeah, exactly. So it just tracks your heart rate and it tells you when to inhale, when to exhale to maximize HRV, which is good for just overall nervous system resilience, performance, things like that. However, there is a certain metric that every athlete is familiar with, and it's called feel. Feel is that kind of unquantifiable, feeling of kind of being in the zone, right? Like, when
Yes.
you're feeling it. If a 3-point shooter is feeling it, like, they're not going to tell you like, oh, my mechanics are perfect right now. They're just like, dude, I'm just feeling it. Like, I feel like everything's going in. Same with golf. Like, there's this thing sometimes that you get where you're just feeling the swing perfectly. And it's like, I don't know what's happening, but I feel like every shot is going to be perfect right now.
Everything
And so,
slows down, right? The ball looks bigger. You feel like your reaction time increases, right?
yeah. And so feel is another incredibly important metric to try to figure out how to improve. And what I've found is typically muscle tension is the most correlated to feel. So if you're like really tense, it's really hard to feel good. It's hard to lock in that feel. You can have a fast heart rate. If your heart's beating out of your chest, you can still lock in the feel. A lot of high performance people will say like, hey, when I was performing, my heart was pounding out of my chest, but they still dial in their performance and they crush it. It's more about, at least what I've found, especially in golf, is just having muscle tension be low. And we found, at least with our vagal nerve stim, we can see significant reductions in muscle tension. But I'll get that in a second. For the breathing technique, I found that it's kind of crazy, but a 15-second exhale is the best way to boost your feel. So when you exhale for 15 seconds, I mean, you're getting everything out. And if you do that for like even just a minute, you're going to start to feel a little bit tingly. Everything slows down when you breathe that slow. So if you're like feeling really amped up, the 6 breaths per minute is good, just in general, but it's not the best to increase your feel. So like when you're tense, your feel is
Yep.
really low. But the slow 15-second exhale. So I take a deep breath and I exhale for 15 seconds. And I just, you can count it. It doesn't have to be exactly 15, but it's a very slow exhale.
And then is that impacting CO2 levels too? Is that lowering CO2? What's happening with that?
It is, yeah. It's more like, well, it depends on, I guess, the rate, or I guess it depends on really your exhale. If you take a big exhale, you're increasing oxygen saturation.
Or inhale, right? Inhale, bring oxygen
Yeah,
in, right? Out is CO2 out, right?
yeah, yeah.
So
So it's I would have to do a little more research on like the exact mechanism, but I know it has to do with oxygen saturation. So when you take a deep inhale, you can measure this with an SpO2 sensor on your finger, but your pulse ox goes like almost to 100, and so
right.
you can do that. When you hyperventilate, your pulse ox goes way down. You can like drop your oxygen levels, super low, and so
Now, are you trying to also focus through breathing on the nose? I know there's a lot of parasympathetic olfactory nerve fibers that hit that parasympathetic part of the brainstem. Are you focusing on through the nose or the mouth? I know the mouth tends to do more of these scalene muscles, which is more of that stress response breathing. How do you cue that?
yeah, I say inhale through the nose. I mean,
Yep.
it doesn't really matter if you're inhaling through the nose or mouth, but the exhale is the most important. You want to exhale through your mouth. You don't want to exhale through your nose. And if you really want to take the sensation to the next level, it's kind of hard, but you can purse your lips and try to create some resistance to the exhale, and you can push the exhale out. So instead of just letting it out slowly, you can purse your lips like this. Like try to not let the air come out. And so you're pushing it out with your chest. When you push it out with your chest, that is a form of vagus nerve activation.
Really?
It's crazy. You can hook yourself to a heart rate monitor. When you do that, your heart rate has this huge drop when you do that. So if you have that heart beating out of your chest feeling, forcing your exhale is probably the best way to bring your heart rate back into your chest. It's really cool to see on the heart rate monitor. It's just like a big drop. And the reason that happens is it's a form of vagus nerve activation.
And how
So
long is the inhale again?
about 5 seconds.
So inhale 5, and you said exhale is about 12?
I say 15.
15, okay. So
They're breathing experts. They all have, some other thing. But the point is
so
a
in
prolonged
5 and
exhale.
out 15. All right, and then
Yeah.
pursing the lips is gonna increase that interoral pressure that activates that glossopharyngeal vagus nerve kind of with the mouth and the palate, essentially, which gets that vagus nerve going.
Yeah. Well, the way I see it is are you like you're familiar with the Valsalva maneuver, right? Like
Mhm.
when you're
That's when you bear
um,
down.
yeah, like when you bear down, you can
Yep.
plug your nose when you're trying to pop your ears, right? Plug your nose and
Yeah.
try to force the exhale out. Don't let it come out. That's like a mild form of a Valsalva maneuver,
Yep.
which causes your heart rate to drop. And so that's kind of what you're doing with the forced exhale. You're like
Mm.
bearing down a little bit, and it activates that vagal response kind of in the upper body area. And so that's typically why we see the big drop in heart rate. Now, it's not going to stay low, it's going to bounce back up. But it's really cool when we have some data that shows when you do this for 60 seconds, when your heart rate is like above 100, when you're just sitting there and you do this, it just steadily drops. You see these big drops, comes back up a little bit, big drop, come back up a little bit. And then it kind of stabilizes in the 60s, 70s, and it just kind of stays there. And it's like, that is crazy. Like that's an incredible breathing hack. If you ever feel like your heart's pounding out of your chest, is just force your exhale for, a couple minutes. It is hard to do, and it can cause some lightheadedness if, you do it too hard. So I always recommend like go slow when you try that breathing technique. Um, and
Now,
that's
mhm.
probably what I found to be the most effective also for boosting that feel. So if I'm on the golf course, even today, if I'm walking up to a putt that I know I got to make this one, that's the breathing technique I would do as I'm walking up. I'll inhale and I'll just slowly exhale. And I'll do that a few times before I hit a putt. And it works. It definitely, boosts my feel, and I make more putts.
That's great.
So,
That's really cool. Now, when you see people like hyperventilating and they give them a bag and they're trying to breathe through the bag to kind of get themselves calm. What's that doing? What's the mechanism there? Is that just more CO2?
yeah, I'm not totally sure about that one. I
I
haven't.
know CO2 plays a role because they're trying to take the CO2 in the bag, and that CO2, I think it's a pH thing. I think they're a little bit more alkaline, and they're trying to take the CO2, which is a little more acidic, and bring the pH down. So they're using recycled CO2 versus air.
Yeah,
Just didn't know if you had a thought on what was happening there.
I don't know. I know that's probably closer to the panic attack range, but
Right.
um, it would be interesting to like put someone on a pulse ox monitor and have them hyperventilate into a bag, see what happens. Um, yeah, I'm not totally sure about that one because I haven't really studied that one for performance purposes. It's never really crossed my mind. But
So we got the visualizations big, right? Because your nervous system
yeah,
does not understand if it's really happening or not. And there's studies on people that do free throws and do it versus visualize it versus not do it. And you see amazing data on showing that they did incredibly successful. They
yeah,
were successful by visualizing it. Plus, if you're an athlete, it's hard to get in a situation where you have a crowd cheering and doing all that. It's hard to do that in practice. So the visualization allows your nervous system to be much more adaptive because now you create hundreds of settings of that versus a couple settings of that. So when you go
yeah.
into that peak performance moment where the crowd pressure's on, you've created that in your mind already. So you walk into it like, this is old hat, right? This is no problem.
Yeah, exactly. When I first started, my company and wanted to build the vagus nerve stimulators, I needed to go pitch in these business competitions to try to get money to, fund the first prototyping. And I remember I made it to this national competition where the prize was $100,000. And being a college kid, that's like huge. I'm like, oh my gosh, I could win all this money. And so I was freaking out, leading up to that event because I had to pitch in front of like 1,000 people. And I'm competing with schools from Stanford, MIT, and I'm like, oh, this is crazy. And
That's awesome.
so I put the visualization to practice, and I was like, hold on, instead of just closing my eyes and visualizing my pitch, I was like, I know there's virtual reality stuff out there. What if I like literally go into that world? And I found there's a virtual reality public speaking app that I downloaded, put on my phone, bought one of those like phone VR things,
Yep.
and you can literally upload your slides into this public speaking app, and you can practice your pitch in front of a virtual audience of like whatever size you want. And so I did that. I did that like 5 days in a row, just giving my talk to a group of 1,000 people, and they're all staring at you. Like they make it so it's
Yeah.
trying to give you all this pressure. And it was legit. The first time I did it, literally my heart was beating. And I'm in a virtual reality world. And I'm like, this is fake, but I can feel it right now. And so I did that over and over. That was my form of visualization. When I got to that competition, the room it was in looked identical to the VR world I practiced in, which
Right.
I was like, that's crazy.
So your
And
nervous
so I
system's not
got
going
up.
to freak out.
Yeah. And I got up, and that was like the most calm I've ever been giving a public presentation, because I went through that visual thing, right? Like I didn't just simply rehearse it in my room, to a wall. Like I went in and I saw the room, I saw the people, and like long story short, I ended up winning the competition, which was really cool. But
Oh, that's
um,
awesome.
that's how we got our start. But just to me, I was like, that's it, man. The power of visualization is so big. When the hard part, it just takes discipline. You got to practice it. It's not like a do it one time and you're good. I mean, it's you do it all the time. Your brain's a muscle. You got to train it just like anything else. So,
So how did then you have all these techniques, right? You're into visualization, you're into the breathing, you're into human performance, and really allowing your nervous system to adapt to these type of environments that you don't have a lot of opportunity to be in. So you're creating this in your brain. How did the Hoolest device come into this? Well, what was the next transitionary step there?
yeah. So the breathwork stuff, was cool, and I could practice it, and it was definitely helpful to a certain extent. But again, when I was on that first tee at the time, I wasn't thinking of these forced exhale modes, or breathing techniques. But the breathing stuff I was doing, it just wasn't like that effective for me. I was like, this, I don't feel good. Like nothing is working to make me feel better. And so I went to school, and I was like, again, I want to study the brain, what's going on in my mind, my body when I'm having these episodes. And I learned about all kinds of techniques. I learned about transcranial magnetic stimulation, focused ultrasonic stimulation, which is, I'm surprised that hasn't really hit the market yet. I mean, it's kind of out there, but focused ultrasound is awesome. You can send in super precise like stimulation, like at any depth in your brain. So it's going to replace deep brain stimulators one day, which is crazy.
Really?
So that was really cool, but way too advanced for what I was looking for. I was interested in vagus nerve stimulation because there was a study that showed when you electrically stimulate it around the ear area, one, you get a drop in heart rate, like immediately when you do it. Two, you get an increase in heart rate variability after, 10 minutes, which I'm like, I need both of those things. And then three, it was effortless. You just put in this little earpiece and just let it do the work. And you just sit back and do whatever. Like, you don't need to think about anything. It literally like optimizes your nervous system for you. I don't have to work on it. And so to me, I was like, that's interesting. And so I bought, this earbud device, took it out to the golf course, tried it. And I did notice a small effect. I definitely noticed, like, over like a putt where I really need fine motor control, I could notice some positive impact. But overall, I was like, I feel like this could be better because like this was only targeting a really tiny nerve inside my ear canal. And it kind of worked. I felt a little better. But then I just went back to the lab and tried a whole bunch of different nerves in the area. And right behind the ear, kind of underneath, this is sort of where like all the nerves converge going towards the brainstem. And when you apply the stim there, it lights up like every nerve in the ear all at once. And it was like 10 times the feeling that I got with one of those ear clips. And I was like, that's it. Like, that's the spot right there.
Whoa. So
When
like
I
where?
did it,
Right here?
it's like pressed into the jawbone. So in that soft spot, it's
Yeah.
like right up in that jawbone
Yeah.
area. So it's mostly what's called great auricular nerve going all the way around the
Yep.
back. And
Yep.
then all the great auricular nerves are connected to the auricular vagus nerve on the inside through these like micro nerve fibers. And when you stimulate it, they all light up. It's crazy.
Wow.
And one thing too we're doing is, the reason it's more powerful is because we are literally adding about 10 times the power that these ear clips are applying. But the reason we're doing that is one, again, I want to feel something. Like, feel is so important for performance. Like, you need to feel like you're in, the zone, like the motion you're about to go do. You want to feel that motion subconsciously. And I found that these weak little earbud stimulators, like, I didn't feel anything. Like, I could notice a subtle effect, but it wasn't like, I'm locked into my feel now. But I found when I just blasted the nerve right under here, it only took like 60 seconds. I'd put it down and I'm like, whoa, like, I feel slow right now. I feel like that progressive muscle relaxation that I would do for 20 minutes. That's how I felt, but after like 60 seconds. I was like, that's so interesting, because now when I do that, it's so much easier to drop into a visualization, like a pre-shot routine. Right before I'm going to hit a shot, I'll step back, do the thing, and I'll like calm down, and then I can just visualize exactly what I want to do without having to go through progressive muscle relaxation for 20 minutes, and I can just lock in. And my performance definitely, it's so crazy. Like, I wouldn't say I'm as good as I was when I was competing every day in high school, because I just don't play that much anymore. But
Right.
I am way more consistent now. Like, I don't have these big blow up rounds, because I would blow up a lot because my stress would go crazy. That has not happened like in 10 years. Like, I have not had one of these episodes where I just blow up and go off the rails, where I used to do that in high school.
And I
Uh,
imagine too, if you're not playing as much, you may just sit down and do a 5 or 10 minute meditation where you visualize yourself playing around. Even though you haven't done it, you'll go back in and you'll be way more at a higher level because your brain is already getting reps, right?
yeah, I'm pulling back the muscle memory that's kind of
Yeah.
deep into my, in my nervous system, my muscles. And that's kind of the cool thing about our device is we're essentially like cutting the time it takes to do an effective visualization by at least half, right? Like, if I can eliminate the 20 minutes and bring it down to 2 minutes, that allows you to pretty much immediately get into a visualization state. And from there, it's just do it however long you want to do it. If you want to do a short visualization, a long one, I mean, that's up to you. But, especially if you're out there, right? There's this term that the Red Bull athletes use. I was talking to a Red Bull performance researcher, and they're really interested in what's called post-air recovery. So when you're in the middle of a performance and you make a mistake, everybody makes mistakes, right? But what sets the best apart is your ability to recover from the mistake and get back to calm and focused, to not let that mistake cause you to go off the rails like it did me. And so post-air recovery is very difficult in the middle of a performance, because to effectively recover mentally, you got to do these long meditations. You got to, like, all right, let's go back and refocus on what really matters, and let's visualize. And it's like, that takes a while. But if you could just quickly reset your nervous system with some vagal nerve stim, like, you've effectively just recovered from an air, and now you can lock back into what you want to do again. So that's like really fascinating, area of human performance that not a lot of people are talking about, but I think it's going to be a big one in sports soon.
That's great. And so have you have any athletes using some of your devices yet, or doing
Yeah,
similar technology?
yeah, we've got athletes in pretty much every major professional sport league. We don't have any like partnerships or sponsorships with them yet. They're just using it. So the best one, I guess the one that we have the most, would be like professional fighting. We've got a lot of UFC fighters using it. From mostly the trainers buy it and use it with all their different athletes. But I have this really cool picture. There's this fighter who's just like sitting down, and his trainer's behind him, and he's about to go into a fight, like waiting for the next fight. Trainer's just holding the device next to him, and the guy's just sitting there visualizing. I'm like, that is the coolest picture ever. Like, that's exactly it for human performance. And fighting is like, it literally is fight or flight. Like, that's what they
Oh,
do.
totally.
So, being able to manage that is essential, right? You don't want your nervous system going off the rails, or you're not going to be able to focus. And as much as, people think fighting is just about brutal, like throw punches. No, you want to be calm. You want your muscles relaxed so that you're precise, right? Like, it's all about precision. And to be precise, you need to be calm. So for fighters, they really, need to practice, nervous system optimization. So
It's the ultimate sympathetic nervous system expression, fight or flight,
yeah,
while still needing to be parasympathetic, while you can plan and be strategic and not just overall react, right? So it's that blend of both. And of course, you're getting hit back, which then creates pain, which then drives you more into a fight or flight. So yeah, that makes sense. That would be very difficult. And so you blended a lot of these techniques that you've already had, and then you said, okay, here's the next level. So why don't we pull out your device and just you walk me through what the
yep.
next step is? So it's been charging here. So this is the device. It comes with a couple of
Yeah, so we call them those are the gel tips. So one of the
so
innovations of this product
these two things,
is,
right? These two little tinctures.
yeah, that's that hydration solution for the gel tips in the gold container jar.
Yes.
Yep. So you would unscrew those, and you would just
Okay.
pop
Unscrew them.
both of those gel tips out, um, and you would
Okay. So we
place
get two.
them. Yep. So you take them out, and then you place them into the top part of the device, just like this. So it looks like that.
And as these devices just meant to conduct better, is that why?
Yes. So the gel tips, this is our first innovation. Every electrical stimulation device out there uses what's called a Signa gel.
Oh, I
That's
see.
the brand of it. It's this like sticky conductive paste. And it's just kind of gross. You have to clean yourself off when you're done. You have to clean the device. And I was like, no one, again, my goal was, when you're out there, you want to have something you can use quickly. No one's going to carry a bottle of sticky, conductive paste with them. So we're like, we have to design them to be, like used without conductive paste. So these are a hydrogel based material. It's kind of like a Jello. We engineered this with just certain hydrogel materials. Hydrogels are, they're used in medical applications of every kind. So they're safe. It's very friendly to your skin. It feels good. So we're just delivering the stimulation through these gel tips, and
And
you don't need to put any gross stuff
and
on
real
them.
quick, does the wide end stay at the top, or does the small end stay at the top?
The wide end stays at the top. So put the
Got it.
skinny end down.
Skinny end down. Got it. Okay.
Yep.
So you have a smooth end on the outside, and it should stick up
Yeah.
just a little bit like that, right?
Yes. It's kind of like a little taser looking device almost.
Yeah, a little taser. All right. And then
So
how do these tinctures work here?
So you don't need to use that. That's
Okay.
basically, over time, these gel tips will dry out because they're a hydrogel
Ah,
based, water based. So they start to shrink a little bit. And so if they're dry, sometimes it can feel a little prickly and sharp. So that is a little hydration solution. You just put a little dab of it on the tip, and it rehydrates it. Makes it more
that makes
comfortable.
sense. That makes
But it's
sense.
not
Okay.
it's not that like sticky gross stuff. It's just like a little solution.
Okay.
So
So I'm
what
set
you
up
do,
here. Yep.
yeah. So you'll want, for your first use, you'll want to turn it up by pressing the right button to where maybe the second or third LED light is lighting up. Yeah, that's it.
Okay.
Yeah, so start there. And then you're going to want to hold it in a vertical orientation like this. And you just press
Okay.
those gel tips right underneath
Right here.
the ear. Yep.
So
Right
right
up
there.
against the
Ooh.
jawbone.
Oh, whoa.
Yeah,
Hey.
that's it.
Nice.
It's
Whoa.
it's
Okay.
strong. And so
Yeah. Whoa.
if
That's
it's
I was
too
not. Okay. That's cool.
if it's too strong, you can turn it down.
Oh, okay. Yeah.
Um,
Yeah. Okay. Yeah. I'm pressing it. Oh, that's cool. All right. And so then now, what do you recommend? So I start this. This is where I start the breathing and visualization.
no, so there's a few protocols. The
Okay.
generic protocol is 5 minutes in place on one side, switch 5 minutes on the other. That's for just
Ah.
the all-purpose like relaxation. If you're feeling a lot of stress, and you don't want to, if you don't have a quiet environment to practice breathing or meditation, you can do this. You can do it anywhere in the office. If there's noise everywhere, you just whip it out, and
So I can do
it's gonna
that in
work. It's
replace
gonna
of
calm you.
that. But now if I do the breathing and this, does that supercharge it even more?
Yeah. So there's two performance
Mhm.
modes. The way that you would switch modes is you would, you can press and hold both buttons, and then you can, it puts it in mode selector mode. And I can explain that in a minute. But our mode number 4 is our coherent breathing mode. So what
Okay.
that means is that the stim is on for 5 seconds, off for 5 seconds. So you want to synchronize your breathing with it, where when it's off, you take a deep breath, and then when it turns on, you exhale slowly while it's on. And you do that for 2 to 3 minutes per side. You don't need to do it for very long if you're breathing with it, because again, the breathing is going to supercharge the vagal stim effects. So that one is really good for like pre-performance anxiety, or even just kind of increasing your feel. Right? You don't necessarily need to be anxious, but you can stimulate your vagus nerve, and it'll prime your nervous system to like lock into the feel, for whatever performance you're about to do. And then you can also do that right before a visualization as well. The mode 4 with the coherent breathing. And then mode 5, this is like the high performance relaxation one. We call this panic attack recovery because it's so powerful. That's the one where it synchronizes with your breathing, but it's a 15-second exhale. So it's on for 15 seconds and you're exhaling for 15. It's crazy. If you just exhale for 15 seconds, do that 3 times without the stim, you'll be like, all right, I feel something that's cool. But if you do it with the stim for 1 minute, it's like way more noticeable of an effect. And you're going to want to sit still on your couch and not move for like a few minutes, because you're like, that's crazy. I feel like everything's just slowed down. And so I don't recommend everybody do that as like the general all purpose. That's for like if you've got a panic attack coming on and you're like really feeling, stressed and anxious. That's the best one for that. So, yeah,
Do
those are
you
the
have
two kind of.
that's awesome. Do you have a video library of all these things? So if someone were to get the device, can they go into a library and kind of have you walk them through it, or how does that work?
Yeah, so we do have a video library. When you buy the product, there should be like a card in there that says scan here to view support materials. And there's a website that has some videos. A lot of these are outdated, and so we're updating our video library.
Right here?
Um,
Is that how it looks?
yeah, that might be it. If you scan that,
Yeah.
there's a few. They're kind of scattered around. That one might be like a digital instructions book or something.
Yeah. Yeah. Okay.
Um,
What it feels like. Okay. Cool.
but
Oh, I
yeah,
see.
we
Okay,
do
so
have
it has mode one, mode two. So just kind of for the listener to see it here. Right, these are different modes there.
yeah, those are the different modes.
Okay, so is that kind of the protocols too?
Yeah, there should be like a generic kind of explanation of the
Slow
protocols.
breathing, 15 seconds on, 15 seconds off. That's
Yeah.
good. And then what was that performance mode that you press both at the same time? What was that?
So that would be modes 4 and 5. The way that you change the modes is by pressing and holding both of those buttons on the front part of the device at the same time, and it'll cycle through the modes in the next mode. So if you're on mode 1, you just press and hold it, and it should cycle through up to mode 5, and then you let go.
And how do you know you're in mode 1 versus 2? Will it be like the mode 1, the first light, mode 2, the
Yep.
second light?
Yeah, exactly.
So if I go like this,
Press and hold it for until it flashes. Okay, so now
let go.
let go.
Yeah.
Now you can use the buttons to toggle between the modes.
And so what's your favorite mode?
Um, my favorite, again, I like to feel the strongest effect. I live on that slow breathing mode, mode 5.
Right there. So
I
it's
like to synchronize.
have an
Yep.
orange one,
Yeah. So
and
the
then now what?
reason it's orange is there's a regulatory statute when you use electrical nerve stim. When you reach a certain level of power, you have to have a yellow indicator saying like, "Hey, caution is warranted,"
Yep.
just because it's a high power device. And this
And now
is the
that's
highest
on.
power. Yeah.
So I press it again together,
Yep.
select
To
it.
lock
So
it
now
in. Yep.
I select it.
Press and hold about a
Oh, press and
second.
hold, press and hold. Okay.
Yep. So now you're locked into mode 5. Yeah, it's kind of fast. You just kind of feel it out. You accidentally held it for too long and it went
Uh, uh,
back into.
okay. All right. So now press again.
Yep. Now you're in.
Now I'm in. Now that's mode 5.
Yep. Yeah. So it should be the same kind of feeling, but you might catch it in the off and then it ramps up.
I feel it. Yeah, you're right. I feel it. It goes off and then on.
Yep.
And this is your favorite.
That's my favorite. Yeah.
Ooh.
And so I'll briefly touch on the 5 different modes. So mode
Yes.
1 is an 8 hertz constant stimulation mode. That one is ideal for just general like state anxiety levels. So anxiousness in the moment, which is a little different than stress. It's a bit more like worrying thoughts, maybe like your stomach's churning a little bit. Um, and then you can also use it on the median nerve. So the median nerve stimulation is really good for like nausea. So that feeling in your stomach.
Oh,
You know,
that's cool.
there's connections here in your gut. And so a lot of our functional neuro people will use it here for patients that have nausea. And I get feedback all the time from pregnant ladies who are like, doing median nerve stim throughout my pregnancy like helped, reduce the nausea. And so
Oh,
the cool thing about our device, it really is multi-purpose. We have new protocols that are coming out in our Gen 3 where I explain to you that you can do a few minutes here, a few minutes here, a few minutes here, a few minutes here, and like now you're getting a multiple nerves going at the same
that is
time.
cool. And so with the
Any other
median,
device can't really do that.
right? So the medians are right here.
Yeah, it's kind of in the wrist, and you just move it around until you should feel like that buzz going up into your hand. Mode 5 isn't going to be as good for median nerve stim. You'll want to use mode 1 for median nerve stim. So remember, press and hold if you want to try
Yeah.
that. And you can crank it up on the wrist. The wrist is a little less sensitive. So, yep, you're good. Now go ahead and crank it up.
Oh yeah, it's definitely less sensitive. Oh, I feel it now. Yeah,
Yeah,
the
it should
neck's
feel.
way more sensitive than the wrist.
Yeah, definitely.
Oh, that's cool, and that can help with the nausea. That makes sense.
Yeah, that's really cool. You do that
Oh,
for
I feel
just,
it. I feel it.
a
Oh
couple
yeah.
minutes. Yeah, it's awesome. Like you only need to do it for a couple minutes. You can do it for a few minutes on one side, a few on the other. And if you really want to, feel even more like, well, you can go back to the vagus. So every mode in the product, you may want to turn it down because it's super high. But
Oh yeah.
so 8 hertz, you can feel
Ooh.
the slow pulses a little bit more
Oh yeah.
pronounced.
Okay, so yeah, the slower pulses from 8 to 100, you feel it a lot more. It's more of a punch.
Yeah.
Ooh.
Which is interesting because it's lower frequency, you're delivering a little less power over time. So 8 hertz is actually what we recommend people use if they've never experienced like electrical vagal nerves before, just so it's not overwhelming to them. The 100 hertz, which is
Ooh.
modes,
I just did 100 at 5. That's really intense.
yeah, you might want to turn it down for 100 hertz. It looked like you had it cranked up.
Yeah. What should I do it at? Just go to
Like middle. Oh, you can just turn the intensity down. Yeah, just to about the
oh,
middle.
I see. So I can be at that mode 5, but then I can decrease the intensity while in
Yeah.
mode 5.
So the
Oh,
right
okay,
and the
got it.
left button turn the
I see.
strength up and down.
So I can be in either mode, but then decrease the strength in each mode. Cool.
Yeah.
Okay, so now. 100 hertz. 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 Okay. Yep. Oh yeah. So right around that 2 or 3 feels better.
Yeah, so there's definitely some playing around with each of the modes to kind of dial in what feels good. Mode 2 is a 25 hertz frequency stimulation, which you can do auricular vagal as well, but it's also good for trigeminal nerve in the forehead. This is, for me, this is
Mm.
my second favorite application for headache. So
Okay.
anytime I have a headache, like my head's throbbing, you can kind of move it around, and then above either eyeball, you have the supraorbital
Oh
branch,
yeah.
trigeminal, and you should feel like a streak going into your skull.
Yes, totally feel that. I feel like it's
So if you have
going
a
right to
headache,
that hair.
yeah, if you have a headache, it's like it disrupts the pain signal and you feel the pain. And it's like, oh,
Wow.
sweet relief. It feels so good.
Oh yeah.
However, it doesn't, in my experience, make it go away. So like if I take it off, pain kind of comes back. But in the moment, it just feels so good when you have a headache. If you don't have access to ice or a cool or a quiet or a dark environment, if you're out and about with a headache, you just pull it out and boom, apply it here. We get a lot of people that say auricular vagal nerve stim helps with their headaches as well. So um,
That's
that
cool.
so that's another cool application with the product.
Now, where I see an interesting application is I work with a lot of patients that have, emotional trauma, PTSD, and they do EMDR or EFT work or NLP or hypnosis along with that. And so EMDR is using eye movement stuff to access different parts of the brain. EFT is using different meridian or acupuncture points to disrupt, let's just say, subconscious thinking patterns. And so I see something like this that is stimulating that vagus nerve, activating more parasympathetic while doing some of these, maybe an application to accelerate healing and recovery. Any thoughts on
Yeah.
that out of the gates?
My thoughts are PTSD is our number one most cited benefit from our customers. So people, like, of all the reviews we get, most common citation is I have PTSD and this has transformed how I live my life because now
Wow.
I can go out and don't have to worry, like, when I'm out there, if suddenly I have an episode, like, I can pull out the device and use it, and it just calms me down, and I stay where I am. And I can't say it treats PTSD, but if you think about it, like, by definition, you have PTSD when your anxiety prevents you from living a normal life. Like,
Right.
that's what's in the diagnostic manual. It's when you have it's when you have both the anxiety episodes and the anxiety episodes cause you to change your lifestyle where you're
Right.
avoiding normal environments. So if I can help you get back into a normal environment, like, I mean, that makes living with PTSD a heck of a lot easier.
Right.
And so that's, at least anecdotally, that's the number one piece of feedback we get. And it makes sense just because I know PTSD has a lot to do with overactivation of the amygdala in the brain. And in all the primary fMRI studies that have been done with auricular vagal nerve stim, they show that when you stimulate it, activity in the amygdala comes down. And so if I can reduce the fear response in your brain, it would suggest PTSD is going to be probably a top application. And that's what we've been finding just anecdotally. We never did the fMRI studies ourselves because we don't have massive funding from governments to do that. But that's what's been found in other studies.
Yeah, just to kind of, highlight the parts of the nervous system that we're dealing with, right? You have your nervous system, you have the peripheral and your central, right? Peripheral is
Yeah.
everything going from the spine outward, and your central is your brain to your spine. Now, within that, we have our autonomic nervous system, and I call autonomic is automatic, right? That's where breathing, your intestines moving things, your blood flowing, that's all automatic. And on that, we kind of have two parts. We have the sympathetic, which is the stress or fight or flight, and we have the parasympathetic. So just to kind of highlight here, anytime we're in this PTSD or this trauma loop or panic attack, essentially we have this teeter totter. And essentially, when that sympathetic nervous system goes up, panic attack, breathing, stress, negative thinking, our parasympathetic goes down, correct? And so what we're trying to do is essentially level out that teeter totter. Is that correct?
Yeah. Yeah, definitely.
Okay. Just
Um,
people have a visualization of it because I know it can get a little technical. So
Yeah, so people might
automatic,
say,
yep.
like,
Mhm.
they might say, like, rebalance the nervous system. So that's that visual you just gave, like, balance it. They might say reset the nervous system. Um, in one way, or they're like, studies are all over the place about, like, exactly what it's doing to the nervous system. Some of them say we're just reducing sympathetic. Parasympathetic doesn't change. We're just reducing sympathetic. Well, if that's true, well, that's still good. You're still bringing down the fight or flight response. It makes you feel calmer. Other studies show that it just increases parasympathetic. So you're still dealing with stress, but you're feeling a little more calm because parasympathetic's coming up. I mean, we're back and forth, but the point is we're rebalancing the nervous system. We're allowing you to be more stable, more resilient, and you're just not going to feel as overwhelmed as you would if you didn't stimulate your vagus nerve.
That makes sense.
And one quick thing too, I get this question all the time, like, oh, you can stimulate your vagus nerve for free using breathing practices or humming. And so that is true, but that was the conventional wisdom that I was discovering was not effective for me when I was experiencing these episodes, right? When I'm out there on the golf course, I can hum and be like, but like, I'm not going to feel any different from that. Again, I need something strong. I need something that like works faster than traditional humming or slow breathing. And so there's data specifically that looks at the effects of state anxiety, where you might do slow breathing. How does that affect your state anxiety? You might do all these other techniques. And so I just looked through, all these different techniques, and we found that yogic breath work was the most powerful breathing technique to reduce state anxiety, far, far more effective than humming. And 10 minutes of yogic breath work for the average untrained person, which is what I deal with. I deal with untrained breathing people. The average reduction in state anxiety is about 25%. And so it doesn't sound like a lot. That's actually pretty good.
Is that based on brain waves or what? How are you basing that?
No, it's so literally subjective questionnaires.
Got it.
So you have a list of 20 questions, and you just put a number on it. That's how they clinically diagnose anxiety, is they ask you questions. It seems weird. Like you might think, oh, let's go look at your heart rate, your cortisol levels, your brain.
Right.
We'll
Isn't
give you
that
a stress diagnosis. But that's not how they do it. It's literally like, how do you feel right now? Do you feel stressed? Yeah. Well, you're probably stressed then, whatever. And so we were able to show, second, there's a study that shows how benzodiazepines within 10 minutes can cause, like Xanax, can cause a reduction of state anxiety by about 35%.
Yep.
Now, 10 minutes, it typically takes 10 to 30 minutes for those to kick in anyway. And if you're looking for super fast, instant results, you're not going to take a benzo anyway. That's more for more of a treatment, and long-term sustained effects.
Right.
Which is not really what we're trying to do. In our study that did the same protocol as, these other breathing studies, the benzo studies, we were able to show anywhere from 30 to upwards of 36% reductions in state anxiety after 10 minutes of using the device. So we're on par with the strongest anxiety medications. We're more effective than yogic breath work, which yogic breath work requires a quiet space, mental energy and effort and focus. And, you'll feel better after doing it. But when you electrically stimulate your vagus nerve, it's less effort. You can use it anywhere, and you're going to have a more potent relaxation effect. It's kind of what I call it. And there's really nothing out there that provides similar results, right? You can use a generic TENS unit, right? I can buy one of those $30 TENS units off of Amazon, and they come with these little ear clips, and I can clip it to my ears. But in the studies that we show, the ear clip is nowhere near as effective at balancing the nervous system as this. And subjectively, we found it causes more stress because it's uncomfortable. So if you think about it, if you're trying to subjectively feel better, if I'm exerting pain on you, you're not going to feel better. And so generally speaking, those ear clip electrodes, after 10 minutes of wearing it, it's really uncomfortable. You're like, get this off my ear. It hurts. Whereas this, it's like, there's no pain other than if you turn it up too high, it might be too intense, but you just turn it down. Same thing with an ear clip, just turn it down. So, and then a TENS unit, right? It's like a bulky machine. You got to plug it in with wires, connect yourself. It's fine if you're at home, and you want to save money and, you're okay living with a very mild effect. But if you're out there, right, and you're like, man, I need to calm down now, tens units is not going to get the job done. You know, you need something like the Verilief, which just blasts all the nerves, and it's super easy to do. So
That makes sense. And so, if we just kind of recap the best way to use the device, so just to be clear, we turn it on, up and down as power, and then we can hold it in the middle, and that allows us to go to mode selection. You
yeah,
like mode 5, press and hold to lock in. Now we're locked in. This can then do the intensity. We said 2 or 3 is pretty good. It's 5 seconds, 5 seconds on, 5 seconds off. And then you recommend going back to that breathing protocol, 5 in and 15 out, pierce lips to increase that intra-abdominal pressure, because that does what? That causes a drop in heart rate when you increase the intra-abdominal pressure?
yeah. So if you want to, take it to the max level of like, subjective feelings of, stress reduction, I would say, purse your lips, force the exhale while you're doing it, because that is more of like a total vagal activation in your upper body, because that's kind of the Valsalva maneuver you're doing. We're targeting the upper auricular branch of the vagus nerve, which
Okay.
does not have any descending tracks, projections to the body. It just goes to the brain, which is good, right? That's why it's good for stress and anxiety up in the brain. But when you
So it
do the
terminates down here and up to the brain. It does not go deeper into like the thymus, the thyroid, the
The
deeper
the
intestines.
auricular does not. The
Okay.
cervical branch does have projections downward.
Can
So
that be done there?
yeah, you can actually do it.
Where?
It's kind of hard, just because it's deeper in the neck, and you have to like really push it in.
I
And
feel
there's
it.
not
I feel it. Right. Uh, I
it,
felt it.
yeah, it's a little bit more challenging. You're not going to have as pleasant of a sensation like you will with auricular. You're going to get a little more muscle contraction. It doesn't feel as comfortable, but you're hitting it when you'll see a drop in heart rate. The thing about cervical, there are some cervical vagus nerve stimulators out there. It's important to understand. There's one company, and you could call them a competitor, but really, they're the ones that pioneered the non-invasive vagal nerve stim. It's a handheld you apply to the neck, and they're applying upwards of 55 milliamps current to the cervical. Our product maxed out at 16 milliamps. So we're like 4 times less than the other device that goes here. And the reason they do that is because the vagus nerve in the cervical region is deeper in the neck. It just requires more power to actually hit it. Now, there's another device that comes around on both sides, and the only study they cite used 2 milliamps of current. Now, you're going to feel 2 milliamps on your neck because you'll just feel it. But the thing is, 2 milliamps is nowhere near powerful enough to actually hit the cervical vagus. You need a minimum 10 milliamps to hit cervical vagus nerve. And so if you're going to be applying 10 milliamps on both sides, you're going to get like severe muscle contraction. And so,
This is where I feel it the most, by the way, right here. So if here's the clavicle, just above it, and I dig in right there, I really feel it because just having scanned.
yeah,
Would that be an area
that's the area I would teach people to do it.
right there? I feel
But
that.
again, it's hard. It's really hard to find the right nerve in the cervical
I had to
region.
scan and scan and scan, and then I'm like, I poke in, I'm like, ooh, that's it.
Yeah, yeah, it's tough.
Yeah, I can feel that.
Um, but you can do it.
Ooh.
You can.
Yeah,
And
this
I,
definitely feels more pleasant. This has a more of a kind of a
yeah,
massaging type of feel to it.
yeah, yeah. It's if you're just looking for stress, anxiety relief, the auricular vagus is the best.
Okay.
It's
Okay.
most
Very cool.
comfortable.
So do we hit all the big kind of simple protocols out of the gate for the average listener to kind of wrap their head around?
Yeah, yeah. Really generic. Just the all-purpose protocol would be 5 minutes on each side, and you really want to feel that buzz up in
While
your
doing the
ear.
breathing.
And it
Got it.
feels really good. It's like a very pleasant buzzing sensation. It just feels nice.
Okay.
And
That's
then if
cool.
you want to enhance that calming effect and shorten the treatment time, you can add the breathing with it, which amplifies the effect, which means you just get that effect faster and you don't have to do it as long. It just takes a couple minutes total. Um, that's how I recommend it. One thing to note is what you're holding is what's called the Verilief Prime. The device is called Verilief, Verelief, Verilief. The Verilief Prime has the 5 modes of operation. In the Gen 3 that we're taking pre-orders for right now, I have a book of protocols where I have it's like 10 different protocols for how to do all these different nerve stimulation. So I teach you median, trigeminal, combinations of all of them, and all the other modes as well. And so, I mean, this device, it's $400 MSRP, but really when you combine all the protocols with it, you're getting value of like 5 devices in one. So you probably have to spend well over $1,000 just to be able to do trigeminal, median, auricular, cervical. So it's great value. However, we realize not everyone needs all of that anyway. So we are coming out in the next couple months with just a super general single mode device just for auricular. And that's going to be priced at around $199. So a lot more affordable for people who are just looking to get into vagal nerve stim. So we'll have kind of both, right? We'll have the intro version, and then we're going to have the more like holistic, if you want to really take care of your nervous system, multiple nerve stimulation protocols. The Prime's the best one. So
That's great. And then what's this one called here? This is the Verily
Prime.
Prime, Verily Prime. And what does this one run?
That's 400. That's the
Good.
$399 version.
Okay.
Yeah.
All right. Very good. And then just to be clear, because I have had patients that said, well, I got to work on my vagus nerve stimulation, and I see their diet may not be good, or they may not be sleeping well.
Yeah.
And so just to be clear, everything works better when we have a healthy diet, lifestyle, and everything else kind of dialed in. Things are going to work better because you already have a foundation for that sympathetic, parasympathetic balance to be more in tune. Is that correct?
Yeah, definitely. Yeah. You don't want to just rely on this. If you're, like electrical vagal nerve stim is, I would say it's closer to the healthy type people, the healthy high stress people, than
They're
people that
biohacking.
have like severe chronic nervous system imbalances.
Got
Just
it.
because those people need to ease into this. If they go straight into electrical nerve stim, it can sometimes cause the opposite effect and cause them to have a severe anxiety response. That's just because their vagus nerve is not toned enough to receive electrical. And so you might.
How would they start? Would they start on 1, the lowest setting?
Yeah, they would start with the lowest setting.
Okay, I'm on that now.
And even if the lowest setting, some people it'll feel too much. That's where I just teach them the breathing. Right? Just slow your breathing down. Do that for 10 minutes every day.
I can barely feel it. On 1, I
Yeah,
can't even feel it. 2 clicks in, 2 to 3 clicks that I feel it.
yeah. Yeah, most people won't feel it at 1, but there are
Okay.
some of those patients, right, where it's like they've got seriously imbalanced nervous systems. They would start at just 1.
And that makes sense. They may not be able to perceptually
know,
feel it, but their nervous system is sensing it.
Yeah, and we don't really have a ton of protocols for those types of people, just because that's not what our core focus is. Our
Right.
core focus is on helping people optimize performance, manage stress when you're out there on the go and you got a million things to do. But there are some, other protocols that can apply to everybody.
That's awesome. Excellent, Dr. Nick. Well, great. We're going to have an affiliate link for all the listeners here. So in the description, it's justinhealth.com and /Hoolest, HOOLEST. We'll have that link up later on today or this week for sure. We'll make sure it's up. Dr. Nick, thanks so much for being on the podcast. I mean, you dropped some serious knowledge bombs in regards to other modalities, your device, combining it with the breathing, combining it with the visualization, your experience in top competitive golf. I think that's a lot of people can empathize with that. Is there anything else you want to leave the listeners with?
No, not really. We're a team of engineers, and we're obsessed with building the best products. We are not at our core a marketing team trying to utilize all these crazy marketing techniques to get you to buy some scammy. We're a legit team of core engineers building cool stuff. If people buy and they want to try it and they have questions, like every question, like I see everything and I talk to people every day that are using our products because I want to know how it's helping you. I want to know if there's anything I can do to help you. And just that feedback helps us continue to make better products. And so that's why we're on the 3rd generation Prime, because I listen to everybody in their experience and I want to keep making the best product. We've got 2 others in the works. We just launched a private release of our first batch of our next gen product to our a select group of our customers, and we're going to start getting feedback on that. So we got all kinds of stuff coming. So just want people to know, hey, we're a legit team of people over here trying to build cool stuff. So we'd be happy if you guys took the plunge and tried our stuff and just helped us create a whole new future of, nervous system wellness without medications and, things like
I
that.
love it. I love it. We're going to put the link in the description. I've been people watching the video. You'll see that I'm doing Dr. Nick's protocol the whole time. I got the cranial stimulation happening, doing the protocol, breathing in for 5, piercing the lips, increasing the intra-abdominal pressure on the 15-second outflow. So I definitely feel a difference. I think this is a modality that people should put in their biohacking toolbox, if you will. So I love it.
Yeah, for sure.
Awesome, Dr. Nick. Well, we'll wrap up here. We'll put the links down below. Get your device here if you guys want to take your stress reduction capacity to the next level. I appreciate it. And excellent chat, Dr. Nick.
Excellent. Yeah, thanks so much for having me. This is awesome. So.
Awesome. All right. Thanks, care.